Have you ever cleared the mucus from your throat, opened up your sinuses, and finally coughed up that phlegm from your chest, only to wake up next morning and realize that this mucus has come back again? And you might have tried several medications, inhalers, and steam inhalations, and they do work for a short amount of time, but they are not stopping this mucus from coming back again and again. And the most important thing to realize is that your body is making mucus on the daily basis because something is triggering your body to make that mucus. And until you stop that trigger, you will always be dealing with this mucus time and again. So in today's video, I am giving you this complete 3-step protocol, which first focuses on identifying the trigger which is producing mucus in your body. Second of all, what you can do to thin out this mucus and get rid of it. And third of all, I'm going to share with you my morning, afternoon, and nighttime routine, which not only is going to help you in clean up your sinuses, but on long-term basis will help in preventing that mucus production in your body. Hi, I'm Dr. Anshul Gupta, a former Cleveland Clinic functional medicine physician from US. I help people improve their chronic diseases by making personalized functional medicine plans. So let's start from step 1. Identifying the trigger of why your body is making mucus. Well, most people think this trigger is an infection. Well, that might be the case, but when you have chronic mucus, the trigger is not infection but inflammation. Now, this inflammation in different people can be present in their sinuses, can be present in their lungs, or it can be present in their gut, which is leading to this excessive mucus production. So let's first identify where your trigger is, and for some people the trigger might be present in more than one places. So the first source of mucus can be coming from your sinuses, and along with mucus typically people will have blocked sinuses, blocked nose, they will have sneezing episodes, or they will feel pressure around their face, specifically in their sinus areas. And more importantly, people will feel this drainage coming down on their throat. If any of these symptoms are present, then this signifies that sinuses are one of the sources of your mucus. The typical triggers of this sinus mucus can be allergies to the environment around you, which can be pollen, dust, and it can also be mold that might be present in your environment. Plus, certain bacteria and viruses can live in your sinuses for a very long time. All of these triggers will create local inflammation in your sinuses, and that ultimately leads to mucus production on the long term basis. Now, there are easy ways to flush out these toxins and microbes from your sinuses, but we are going to talk about that in step 2. Now, this is trigger number 1 of mucus, inflammation in your sinuses. The second trigger is present in your lungs. So specifically along with mucus production, you also feel that your lungs are congested. You have wheezing episodes. You have a chronic cough along with it. And the mucus comes out only when you take a deep cough. These are all signs or symptoms that there is inflammation present in your lungs, which is leading to this mucus production. Now, the typical triggers for mucus in the lungs can be obviously acute infections like pneumonia, but for long-term basis, it can be COPD, asthma, or bronchitis. And more importantly, again, it can be triggered by the environmental toxins, specifically mold. And plus, if there is inflammation in your lungs, that will also lead to this mucus production. So that's the second source. Now, interestingly, there can be a third trigger of mucus, which is inflammation in your gut. Specifically, if you have issues with your stomach. If you have gut inflammation that irritates your throat pipe and leads to mucus production. And typical symptoms of that is that when you're waking up in the morning, you have sour taste or you feel burning sensation in your throat. But one of the most important signs is that you feel this mucus in your throat, specifically after eating meals. That is telling you that it can be food sensitivities or certain foods which might be leading to gut inflammation, and this mucus is being produced because of that. So that's one of the biggest trigger. Plus, poor gut microbiome or bad bacteria in your stomach or your gut can also lead to gut inflammation and in turn leads to mucus production. So that's step 1, identifying why your body is making this mucus. Now let's move on to step 2, what you can actually do of each and every trigger of this so that you can reduce the mucus production. So let's start with your sinuses. Now the problem with our sinuses, those are difficult places to reach in our body, and that's the reason chronic inflammation and toxins accumulate over there. So first we need to make sure that we are regularly flushing out these sinuses, and plus there are certain supplements which have shown that they can specifically work in the sinus area for you. So the best way to flush out toxins from your system is by doing nasal rinses. But regular water doesn't do much to rinse your sinuses properly. So for that, whenever you are doing nasal rinses, first of all you need to use saline water, not regular water. And then you need to add a little bit of pink Himalayan salt and very small amount of baking soda. So what these things do is that they completely flush out your toxins, break down that complex mucus, so that way your sinuses are cleaned completely. That's the first thing. But there are a couple of supplements which are very useful over here. One of them is bromelain. Bromelain is an enzyme which actually comes from pineapple, but in research studies it has shown that it can reach your sinuses, reduce inflammation in your sinuses, as well as reduce swelling and mucus production in your sinuses too. So bromelain is a great supplement specifically if you want to improve your sinuses. The second supplement over here is quercetin. Quercetin is a strong antioxidant which has shown in research studies that it can improve allergies as well as your body's reaction to environmental allergens like your dust, mold, as well as other things. Plus, quercetin also helps in stabilizing your mast cell tissue. So it stops the histamine release and again improves your sinuses. So that's the second supplement that you can include. Typical dosage of quercetin is between 200 to 400 milligrams. So that's the first thing you can do, working on your sinuses. The next thing is to working on your lungs. Now, as you might have realized, the mucus in the lungs is very thick and very difficult to remove. That's the reason you feel fullness in your chest or you have difficulty breathing. But interestingly, there is one supplement called NAC, N-acetylcysteine, which has consistently shown in research studies that it can loosen this mucus as well as thin out this mucus and make it easier for to remove from your lungs. The typical dosage of NAC is 500 milligrams, either use once or twice a day. So specifically, if you do have thick or difficult mucus in your lungs, using NAC as a supplement will be really good in supporting your lung health. But along with using this NAC, you have to use this specific breathing technique so that all that mucus which is accumulating in your lungs and the NAC which is making this mucus thin, you still have to remove it. And this breathing technique is actually very easy. You sit upright in a chair, you take a deep breath from your nose, and you hold this deep breath for the next 3 to 4 seconds. That helps to loosen up your mucus in your lungs. And then you exhale forcefully through your lips like you are blowing out your candle. That will help in removing this mucus from your lungs. But you have to repeat this cycle for 5 to 7 times. So if you combine the NAC with this breathing technique, you will be able to remove significant amount of mucus from your lungs. And the third source is working on your gut, because this mucus might be worsening because of gut inflammation. In this aspect, 2 foods which you need to give up will help you immensely. First is dairy and second one is gluten. Several of my patients, as soon as they gave up gluten and dairy for 3 to 4 weeks, they see a significant decrease in mucus production from their lungs and their sinuses. Second of all, make sure you are including a probiotic supplement. A minimum of 30 to 50 billion probiotic strains is what you will need to support your gut health, and in turn that is going to help you in reducing mucus production in your system. I have created this special probiotic supplement. If you want to buy, the link will be in the description. Now, along with doing these specific things, it is very important to reduce inflammation in your body. And for that, specific herbs like turmeric, ginger, boswellia, green tea extract are really good in reducing inflammation not only in your lungs but in your sinuses as well as in your gut. So make sure you're including these foods on the regular basis in your diet. Again, I have created this specific InflammaPro supplement which have all of these anti-inflammatory and antioxidant herbs including quercetin for you to improve your respiratory health. The link will be in the description if you want to buy it. So that was step 2, working specifically at a deeper level, not only to clear up your lungs and your sinuses, but working with your body so your body produces less and less mucus. Now let me share with you my morning, afternoon and night time protocol, which you can easily follow, which slowly and slowly will clear up your sinuses and your lungs and hopefully will also reduce the mucus production in your body. So let's start with morning protocol. As soon as you wake up in the morning, this is the time when people will feel blocked sinuses or their chest being congested. So you need to start doing things to open up these sinuses and your lungs. So for that, the first thing you need is a warm anti-inflammatory drink. For that, easily you can warm up 1 cup of water. You can add half a teaspoon of turmeric powder, grate some fresh ginger into it, squeeze in half a lemon or lime, and sprinkle some black pepper powder into it. And you consume this warm drink as soon as you wake up in the morning. What it does is that the warm drink will help in loosening up the mucus. After consuming this drink, you need some body movement to clear up this mucus. For that, either you can do 5 to 10 minutes of gentle walk or you can do those breathing exercises which I shared with you before. And after this, if you still feel your sinuses are clogged, then you can do a saline sinus rinse in the morning also. If you're doing supplements, the Inflammapro supplement is a good one to take in the morning along with your NAC supplement. Now let's move on to afternoon. Afternoon is all about paying attention to your food. Make sure with your lunch you're not eating any dairy or any gluten. Instead, you are eating a lot of anti-inflammatory foods, which are non-starchy, colorful vegetables, good quality proteins, and if you can include half a teaspoon of extra virgin olive oil or coconut oil, that will help you support your sinuses as well as help you support your lung health. And afternoon is the time where you can include a probiotic supplement to support your gut health. And on top of that, you can include a bromelain or quercetin supplement also. Now comes the night time. First thing to know in your night routine is that make sure you are eating your dinner at least 1 to 2 hours before your bedtime, so that the food is processed properly in your gut and will help you in reducing inflammation. Second thing, before you sleep, make sure you're either doing those breathing exercises or again doing some gentle 5 to 10 minutes of walk. So any mucus that you might have accumulated throughout the day, you are able to remove it again before you go to sleep. Now this is also a good time to take another NAC and Inflammapro supplement, so that way you be in the anti-inflammatory mode throughout the night and the mucus doesn't accumulate in your system. But take them with dinner and not at bedtime. Now, if you do feel that your sinuses get congested in the night time, so you can easily do a nasal rinse by adding saline water, little bit of pink Himalayan salt and baking soda into it, very small pinch of it, so that your sinuses are completely flushed out and you can sleep properly. That's it. This is the morning, afternoon, night protocol, which has helped several of my patients to keep their sinuses and lungs clean. And when they use it for the next 3 to 4 weeks, what they will notice is that slowly and slowly the mucus production in their body is decreasing. So that way they are able to breathe better and overall feel healthier. I want to make sure that the advice I gave over here doesn't replace your local doctor's advice. So if you're not feeling good and symptoms are worsening, then make sure you see a local doctor who can examine you properly and make sure there is nothing dangerous going on with you. So today I shared with you this 3-step protocol, which if you use on the long-term basis can significantly improve your mucus problem in your life. So give this a try and see how you do. Make sure you like and subscribe to my channel before you leave so you keep on getting these great health tips in the future also. Along with that, make sure you share this video with others who might benefit from this information. Until next time, take care. Bye-bye.